nursing sim lab is a laboratory that contains at NCCC 3 adult sim men as the brand name. They are fully integrated mannequins that can breathe. They have a heartbeat, they have pulses. They're capable of doing a number of different functions that the nursing students then can come in and experiment on, experience when they can't do that in the hospital situation without being a danger to some of the patients that are there. We hope that with the sim lab, the students can experience some of the critical natures of patient changes that, other words, in the hospital, the staff would be taking care of. Once something starts to go badly on a patient, you really don't want nursing students trying to make those decisions at that point in the hospital. You want somebody with more experience. The sim lab should be able to give those students an opportunity to practice those critical thinking skills quickly and then go back and look at the tape that they have of it, see what they did right, what they did wrong, how a medication affected the sim mannequins by changing their blood pressure, changing their breathing, and actually be able to experiment a little bit more with some of those things in an atmosphere that's much safer, obviously, than taking care of a real patient in the hospital. Some of the scenarios we have will deal with a person having a heart attack, a person having an asthma attack where they can't get their breath, that we may be able to change their vital signs or their blood pressure so that that is plummeting, and all of a sudden we've got to give a medication that's going to help them to bring that blood pressure back up again. We have 2 sim kids and 2 sim babies that we can then practice some of the pediatric experiences on with getting something caught in their throat or having an asthma attack or having a seizure. Those type of opportunities don't come for students in the hospital, and this way we can simulate them in the lab, they can intervene with them and feel much more confident when they do actually see that situation happen in the hospital. The sim labs were funded with a federal appropriations grant that was given to the college by Congressman Thomas Reynolds. It also has cameras, 3 cameras for each bed so that the students and the mannequin can be videoed, and it will also pick up audio as well. Then that is all going to go into a house of some kind, whether we contain it somehow, so that can be stored for future reference, or they can go into this debriefing session and find out how they did, what the problems were with it, and continue to go on from that. Mainly, the labs are going to assist the students in critical thinking on a safe basis. They will be able to work together in a group in the lab with a faculty member where they will actually show a video of what was going on during that time. They'll have the blood pressure, they'll have the pulse rate, what the EKG looked like, and what was happening during that time in terms of the students interacting. Then they can talk about that. They can come back and say, when you gave that medication, look what happened to the patient. Did you give the right medication? Did it go in too fast? Did it go in too slowly? Should we have given something else?
All right, if you guys could just tell us what you thought about the scenario. How about your initial thoughts?
I don't think the other lab was really giving us real life situations, so I feel like this will definitely give us real life situations.
So those are the kind of experiences that we hope that they can really learn from on a practice basis here in the lab. The new technology's been around for probably 10 years. The Army, the different military operations have been using these sim men for a variety of uses. They now have a fully contained one that is just a body that they can take into the field, take it with them. It's not attached to any wires or any computers. It's all self-contained in that mannequin. So it's just moving into the era of nursing schools where it's become a little bit more affordable. The job market, according to statistics, says that nurses will be in short supply, for the next 10, 15 years. As more and more nurses that have been in the workplace are retiring, we need that turnover of new nurses coming into those positions. The acuity of the patients in the hospital is much higher, they're much sicker, they're there for a short period of time. So not only do we need nurses in the hospital, we also need them now in home care and in rehab centers to take care of those patients that ordinarily would have stayed in the hospital for a week or so. Not too long ago, 15, 20 years ago, somebody went in for heart surgery, they stayed for a full week. Now they're home in 2 or 3 days. Part of the popularity of the program is because we do have good results on our board scores. The faculty is fairly stable. Here we have very high standards. Once a student graduates from our program, they're usually welcomed into most of the agencies in Western New York and usually move pretty quickly into a leadership role. They are easily absorbed into the patient care role in those hospitals. We have one of the largest programs in the Western New York area. Our enrollment has been increasing, fairly rapidly. Many of the other schools have increased their enrollments as well, but they still have not gotten to the level that we have. Our students do very well in the clinical area. Our focus for nursing students here at the college is skill performance, critical thinking, and we try to do a good job of that. Our board scores for our students are always above the national average and always above the state average, and one of the highest in the area.